everybody, Dr. Jody Kinney. Today what I want to do is explain what a disc herniation is and why it's so beneficial to be under chiropractic care to help with any kind of disc herniation or disc bulge that you may have in your neck or lower back spine. But many people are told they have a bulged or a slip disc or a herniated disc and they don't even know what that is. So what I wanted to do today is just give you a visual of what a disc injury actually looks like. To start off with, when we look at what a normal disc looks like, the disc, first of all, is this shock absorber like cushion in between every one of the vertebrae of your spine. At that disc level is where you have a pair of nerves that exits out on either side, and those nerves extend into every single part of your body. The disc itself looks like a jelly donut. The inner core of the disc is very jelly-like. We call it the nucleus. And the outer rings of this harder material are what we call the annulus. The annulus pulposus and the nucleus pulposus. So when you have abnormal wear and tear on a disc or abnormal stress on the disc, what can happen is that disc material can be displaced one way or the other. And if the disc material is, if there's too much compression on one side of the disc, what can happen is the disc material can push all the way out, right? And what happens is it puts pressure on that nerve that extends out in that area. That's called the disc herniation. When we start, initially, when the initial injury to the disc happens, what happens usually is the annular rings of annular fibers start to break down. And that jelly material starts to push out. That's called a bulge. If it winds up pushing all the way out, like I just showed you, that's called a herniation, right? And a herniation, that disc material takes up the same space as these nerves. So what happens is these nerves that are supposed to be small and skinny and sending all the proper nerve supply get fat, they get swollen, they get inflamed. And anything that brushes up on that nerve, be it a ligament or a muscle or a tendon or a bone, is going to cause serious pain because that nerve is so swollen and inflamed. So one of the things that we need to do in order to help alleviate pressure on that nerve is to help alleviate some of the disc material off of that nerve. And one of the ways we do that is by correcting the alignment of the spine. Once we correct and get healthy motion and movement and alignment of the spine, you may not completely resorb that disc material back into the disc because unfortunately you can't get that toothpaste back in the tube, right? It's a very similar phenomenon, or squeezing a jelly donut. Sometimes some of that material can resorb, but ideally when you get healthy alignment, it's going to put healthy pressure and healthy motion on the disc moving forward so that it doesn't happen again. So ideally, one of the best things you can do if you have a bulge or a herniated disc is see a chiropractor. So we treat disc problems all day long, and it's very beneficial for patients to be under care so that the disc issues don't worsen and worsen over time. All right, so if you have a disc problem, come see us. It's important to get your spine checked. It's one of the best ways to treat herniated discs. Signing off, good to see you. Thanks again.